Alright.
Hello, good evening, and welcome to another wonderful episode of the One Dokita New Moms Community Class. Today we'll be talking about a very vital and touchy topic for many of our viewers. It's not just restricted to the pregnant mothers, the nursing mothers, but now we're taking it to the intending mothers. We've had a lot of questions with regards to people who are trying to conceive, issues of infertility in our New Moms Community Forum. And this is also something that's very rampant in Nigeria at the moment. So because of this, we'll be talking a lot today about infertility. So if you are someone who is trying to conceive, trying to have a baby, you've tried, you don't know what to do anymore, or you know anybody who also needs to listen to this about what they can do to help them with infertility issues or conception issues, let them know about this so that they can also listen. Share the link with them, comment, share it, and let them know about it. And remember, whoever you know who is facing such a situation is not alone. We are here for you as one doctor to help you through the process of having your own baby. Because generally, it's been said that statistics shows that about 1 in 6 couples actually have issues with having a baby when they are ready. So it shows that it's actually common, not just in Nigeria, all over the world. And this does not mean that there is nothing that can be done. In fact, there is good news for you with regards to infertility. What is the good news? There are more treatment options than ever before that we have now. And there are also more non-surgical methods that could increase your fertility chances, which are more available now. But in the downside, we might talk about age, that there is increase in age of people before they decide to have a baby, and environmental factors. This might be the negative part of what is going on today. But we are going to touch each and every aspect of infertility in our discussion today. But remember, like I said, you are not alone in the journey to having your own baby. We are here for you. We are here to help you. We are here to put you through. So let's go to the discussion for the day, talking about infertility. First of all, you'll be wondering, what is normal fertility before we even go in depth into infertility? When does it become infertility? When do you need to see a doctor? What are the symptoms? What are the causes? What are the things you need to take note of when it comes to evaluation, fertility evaluation? What tests can be done? What is the treatment available? And the costs, actually, apart from the treatment. And what are some other things you need to take note of with regards to infertility? This and many more are what we talk about. So let's get right to it. What is fertility? Fertility is the natural ability of someone to produce offspring, to conceive and bear children, or the ability to become pregnant and have babies. Simply put, ability to reproduce. And people might think it's just so easy. The sperm and the egg coming together as one, and the baby is made. Yes, that's in simple terms what fertility is about. But in scientific terms, in looking at it with environmental factors, psychosocial factors, physical factors, and everything, there are actually a lot of variables that could affect fertility. First of all, you need a good quality egg and properly functioning sperm to have a baby. And you need enough sperm to swim up the female reproductive tract from the vagina to the cervix to the uterus for fertility to occur. And in fact, through the fallopian tube for fertility to occur, because you need the egg to fertilize it. And in fact, not to leave out the brain. the woman's brain also needs to produce adequate amounts of hormones for fertility to occur, and the ovary itself, which produces the egg, needs some hormones which should allow fertility to occur. So it is in between these places, not leaving out the male also, the ability for a male to, the process by which a male produces sperm, the process by which the sperm is produced, the quality of the sperm, this and many other things are the factors that affect fertility. So it takes about 8 to 12 hours actually for fertility to happen every month between a couple, and the chances that a woman will get pregnant is about 1 in 4, 25% each month when she has unprotected sexual intercourse. So we see how slim the case is, and this usually happens between days 13 and days 15 of a typical menstrual cycle. Note what I said, typical, because we'll talk about atypical or separate cases of menstrual cycle. So a typical menstrual cycle between days 13 and days 15, practically midline of your menstrual cycle. From your menstrual period, start counting to half of the next menstrual period. During this period, you can count some days before, some days after. This is the most critical point in which you can get pregnant. So take note of this. So most couples will achieve pregnancy within 1 year of trying to have a baby, and the likelihood of having a baby in 1 year is actually higher during the first few months, probably because they just got married, a lot of activities here and there, a lot of getting to know each other, bonding, so it's higher. And only an additional 7% of couples will conceive in the second year. Yes, so this leaves out a minor percentage of people who might have some issues getting pregnant after the first year and the second year. So this is when infertility comes in. Infertility is defined as the inability to conceive within 12 months of regular unprotected sexual intercourse. And sometimes this can be brought down to 6 months. This I'm going to explain better why we said it can be brought down to 6 months. So infertility occurs what is the major cause of infertility? Let's break it down. For fertility to occur, we have the man, we have the woman, and they have both of them processes their body goes through for fertility to occur. So in 1/3 of cases, the cause of infertility is the man, and in 1/3 of cases, the cause of infertility is the woman, and less than 1/3 of cases, the cause of infertility is actually the both of them. They might have some problem, and in some cases, you do not even know who has the problem. Either it's the man or the woman. Some might just have below normal or stop fertility, and they might be struggling to have a baby. So what are the symptoms of infertility? Actually, the main symptom of infertility is not getting pregnant. I know you'll be wondering why I said that. Yes, that is not the main symptom of infertility. There might be other symptoms which you may have that you did not notice. So I would urge you to take note of the conversation we are having now, the class we are having now, and take note of this. Try to check yourself, check your husband, or check your partner to know who could be affected, so that you know what to do about it. So the symptoms what causes the infertility would bring about its own symptoms. So the symptoms depend on what is causing the infertility. What symptoms might you notice in a woman? You might notice that she has abnormal periods. It could be heavier or lighter than usual. The periods could be irregular. It could be longer or shorter than usual. Remember, typical menstrual cycle lasts 28 days. 28 to 35 days. So anything below 28 days or above 35 days is a cause for concern. And other symptoms could be that there is no period, or periods just stop on its own. And there could also be painful periods. Notice you begin to have back pains, pelvic pains, a lot of cramps. These are actually symptoms of infertility. We are not saying the person is going to be infertile, but the risk with having such symptoms is higher. So if you have anybody, either you or someone younger or older, with any of these issues, please let them know so that they will start to do the necessary things to help alleviate the problem, or know the cause of the problem and treat it early. Whether they are married or not, it's best to do it once you know, so that you'll be at your best when you are ready to have a baby. Other causes could be related to, other symptoms might be related to hormonal problems. We'll talk more about these hormonal problems. Skin changes, acne, changes in sexual drive, changes in sexual desire, hair growth on the lips, the chest, the chin, loss of hair, weight gain, sometimes weight loss, a significant weight gain or weight loss. And there could also be some other symptoms like having milky white discharge even when you're not breastfeeding, and pain during sex. So these are the things that you might notice as symptoms of infertility in a woman. And what symptoms might you notice in a man? Like I said, this does not necessarily mean that the person is infertile, but the risk is higher in such people that have such symptoms. So in men, it might be very hard to actually know what's going on. The symptoms might not be noticed until the person actually wants to have a baby, such as changes in hair growth, could be on the body or on the head, changes in sexual desire, a pain, a lump or swelling in the testicles of the man, problems with erection, problems with ejaculation, and sometimes testicles that are small or firm. So if, like I said before, you know anybody with this symptom, your partner has any of these symptoms, or you yourself have any of these symptoms, whether you are trying to have a baby now or not, if you know you want to have a baby in the future, take note of these things so that it could be treated now and help reduce or alleviate the problems you might have later with having a baby. So when should people see the doctor actually? Let's place them under two categories. Women who are, although infertility, like we said, is both men and women, but we might be concentrating a little bit more on women in the discussion. So women who are under 35, they should see a doctor after trying to get pregnant without success for a year. So that is where the definition of infertility comes in. Inability to conceive after 1 year of unprotected sexual intercourse. Now, what about those who are above 35? These people need to seek help earlier. If someone is above 35 and trying to have a baby, they should try to do that. Try to seek help, seek the attention of the doctor or healthcare provider within 6 months of trying to have a baby, because their egg quality, the quality of their egg is decreasing as their age is increasing. So it's better for them to seek help earlier. Other people who need to seek help earlier include people with irregular menstrual cycles that are not fitting into what we call the typical menstrual cycle, that are below 28 days or above 35 days. Why? Because it is very hard for such people to actually detect when they are ovulating, to predict when they are ovulating. Like we said, ovulation occurs in the midline, approximately 2 weeks before your next period, so midline of your menstrual cycle. But people who have irregular menstrual cycle, this month it is 21 days, next month it takes 35 days, after that it goes again. Very funny. Sometimes you might not even sit and you're like, are you going to have your menstrual period, or is it that you already have a baby? So when you have such cases, you need to seek help immediately. And also, people who have history of pelvic infection or sexually transmitted diseases already, people who have known uterine fibroids or endometrial polyps already, and men with known semen or sperm abnormality already. These people should seek help, in fact immediately, because they already know that there is something wrong that could reduce their chances of having a baby without treatment. So these people should seek help immediately. So when anybody comes in with any of these conditions, they need to be referred immediately to see an endocrinologist or a urologist, especially for men if they have any conditions such testicular conditions, prostate condition, any sexual problem. They are referred immediately to a urologist or an endocrinologist. And if you are also from a family who have a history of fertility problems, please don't even go about it going here and there. Straight away seek the help of the doctor so that you plan ahead of it. So when you are going to the doctor, what things should you take note of? What things should you, don't just go and that is something you get there before you know what you should take note of. You can write down some information about yourself, like the medications you take already, prescriptions, supplements, vitamins, whether the ones you bought with prescription or without prescription. Write it down. The last time you had unprotected sex, how long you've been trying to have a baby, last time you tried to get pregnant, any changes you noticed in your body, any symptoms, any treatment or surgery you've had in the past, especially those that have to do with the reproductive tract. So any radiation, chemotherapy, whether you drink, you smoke, how much do you take, any illegal use of drug, any history of sexually transmitted infection, any genetic disorder, all these things, maybe in your might not be restricted to you, maybe your family member, somebody in your family. So it takes time for a doctor, healthcare provider to be asking you this question and for you to start answering. So you might plan ahead, take note of these things down, and when you go, you'll be able to do a proper evaluation. So you don't leave any information out that could be critical to your care. So what happens when you go for a fertility evaluation? Major thing is history taking. Like I already mentioned some things that you will be asked that you need to take note of. Others could be how often you're having intercourse, unprotected sexual intercourse, whether you have pain with your menstrual periods. If you've been pregnant before, let them know. And what happened with the pregnancy, whether you already have a baby and you're trying for another one years after, or you've been pregnant before but you lost the baby, something happened. All this information, they are vital. They are very vital. And don't forget, like I said, the family history of any medical problem, especially those that involve the reproductive tract. Let them know. And also, a physical evaluation during the fertility evaluation might be performed. Simply features of PCOS, Polycystic Ovarian Syndrome, or Cushing syndrome might easily be identified just by physical evaluation, just by looking at a patient, able to know. Other tests that could be done for fertility evaluation include popularly called scan, ultrasound. Transvaginal ultrasound can help to detect uterine fibroids, polyps, occlusion of the fallopian tubes, any ovarian abnormalities. Laboratory tests is also vital. This helps to know the blood levels of certain hormones in the body, like follicle stimulating hormone, FSH, estradiol, and other TSH, thyroid stimulating hormone, and prolactin. All these things are important. They help to give an idea of what could be happening in the body. And not to leave out the men, a very important test for the women, HSG. After all these other tests have been done first and they've not been able to detect anything, hysterosalpingogram, HSG, quotes, or simply put, is done to check if there is any abnormality or occlusion in the fallopian tube. So when there is occlusion in the fallopian tube, it might not allow the ovary, it might not allow the egg, which is released by the ovary, to be able to go into the fallopian tube and be fertilized before implantation occurs. So this is a very, very important test. People complain that it's painful. Yes, it's painful, but it actually helps you, the healthcare provider, to see what is happening in your reproductive tract. This is for the women to take note of why the test might be mentioned. And for the men, semen analysis might be done. What are they looking at? You want to see the volume of the semen. It should be at least 1.5 to 2 mils. And the concentration of sperm in the semen. For every 1 mil of semen, there should be about at least 20 million sperms. Then the motility, or how the sperm moves, that should be about 50% motility. And the shape of the sperm in the semen. The semen is the discharge that a man has during ejaculation. So it is in this semen that the sperm of the man that fertilizes the egg of the woman is found. So by taking a sample of the semen, you'll be able to see all these things and be able to see if there's any abnormality in the sperms that is being produced. So a minimum of 5 to 15% normal form of sperm is needed for fertility, for you to be able to fertilize woman's egg. So if it is below this, the person will be referred immediately to a reproductive urologist. Referred immediately to a reproductive urologist. So this is like an overview of the things that might warrant you to be referred immediately, like we said, or within the first 6 months, and you'll be trying to have a baby, that you need to see a doctor. So what are the common causes of infertility? Like I've talked about it in the beginning, I mentioned age. A lot of women these days take time before they decide to settle down, have a baby, maybe because of schooling, work, we want to have a good career, before we now decide to settle down, we want to have good business running, and before you know it, we're getting to our 30s, our 40s, before we start to think of having children. It actually reduces the fertility rates of the woman. People who have children, my dad would say he had his first child at 24 and his last child at 38, and some people are just beginning to have their own children at that age. So you can imagine they will have more issues with getting pregnant than others. Not in all cases, but it is noted that as women age, the numbers of their eggs begins to decrease, especially beyond the age of 45. Beyond the age of 35, it begins to increase, and a woman is really fertile beyond the age of 45. It's not that fertility is not still there, but it's not as high as when they were in their 20s. I don't want to say in the teens because that's like going too low, but early 20s to late 20s, this is like the perfect timing. Everything in the body, the hormonal system, everything is ready for a child. So other things that could cause infertility include ovulation disorders like Polycystic Ovarian Syndrome, hypogonadotropic hypogonadism, such a big word, but something that has to do with disorders in the brain that affects the release of hormones, which would help fertility to occur, and ovarian insufficiency. So some problems in the ovary will affect eggs from being released. So if your cycles are not frequent or they are not regular, this is something that might be considered. And ovulation is usually detected, like we've said, it occurs like midline, between the 13 to 15 days of your menstrual cycle. So a menstrual calendar in a regular menstrual cycle usually helps, but in this case, where you have irregular menstrual cycle, you might need to be using an ovulation predictor kit buy some of that to be able to know if you are ovulating or not, or when you do ovulate, to help you know when sexual intercourse is even more important, so that you might be able to get pregnant. So other tests and treatments might be advised from this stage. What else could occur? Occlusion of the fallopian tubes, like I've talked about before. Occlusion of the fallopian tubes might occur. So when this occurs, it is hard for an egg that has been released to be fertilized by the sperm, because the sperm does not have anywhere to pass through to fertilize the egg. And even if the sperm fertilizes the egg, it is also hard for the egg that has been fertilized to be implanted in the uterus, because it's getting bigger and might not be able to move to the uterus. And uterine fibroids, yes, a lot of people, this is really common these days. And just having them alone causes infertility for a lot of people. There are different types. I don't want to go into the types, but the major one, submucosal fibroid, reduces pregnancy rates to about 50%. That's quite a lot. So fibroids could affect pregnancy. So if you're having fibroids which is causing heavy periods or making you bleed between periods, this is something to note, to look for the solution to it. Surgical removal is available for fibroids, and a lot of people, once they remove the fibroid, they take in a few months and they have their baby. So let no fear of surgery be there when it comes to fibroids. Especially if you've gotten pregnant before and fibroid doesn't allow the baby to grow, please do the surgery. And other things are endometrial polyps, which occlude the lining of the uterus and does not allow implantation of the baby to occur. And like we've said, factors of the male which could affect function, like semen abnormality, we've noted them already, like things which would have not allow a man to have normal sperm, like having too much concentration of abnormal sperm in the semen. So this person might need lifestyle changes, hormonal treatment, surgery. I can't say in particular, because the individual needs to see a reproductive urologist, especially if the abnormality is severe. Other things that might cause male infertility include having sexually transmitted infections, prior sexually transmitted infections like chlamydia, gonorrhea, mumps, HIV, varicocele, like when the testicles, the veins of the testicles are enlarged, and many other conditions, genetic disorders like cystic fibrosis, all of that. And any blockage or damage to the testicle or to the reproductive organs can cause male infertility. And let's not leave out exposure to environmental factors, pesticides, radiations, lead, smoking, alcohol, illegal use of drugs, marijuana, or some medications, antibiotics, antihypertensives, steroids, and all of these, they could affect fertility. Exposure to it too should not be left out. When people make use of hot tubs, hot baths, saunas, and everything, too much of this, and use of laptop close to the body frequently, sitting in the car, people that drive for long hours without use of AC, all these could affect sperm production. Even treatment for cancer could also affect it, both for man and for woman. So let's not leave out endometriosis. This is a condition that affects a lot of women and could affect fertility. And in some cases, the cause of infertility is not noticed. After all these different conditions we've mentioned, somebody has done series of tests, they still cannot identify the cause of the infertility. What can these people do? This occurs like 50% of the time in infertility cases. What can these people do? They should just continue with the fertility treatment that is available for them, because this could actually treat the problem that was not noticed or that they could not highlight, and they could still have a baby. So what are the treatments available for infertility? One most important one is education, like what we are doing now, telling you about the process of fertility, when you have cases of infertility, what are the treatments available, allowing you to understand fertility and infertility and the options available for you. Surgery is also a very important one. Amongst all the abnormalities we've talked about, from fibroids, endometrial polyps, from endometrial polyps to varicocele, testicular torsion, cryptorchidism, a lot of these things can be treated by surgery, and usually done by having an incision, and they quickly do the surgery, and that is all. And like most importantly, like I mentioned before, removal of fibroids. This is like one major one. So they might need to make an incision to remove the fibroid, or they might need to make a hole to pass through a like small camera to help see the uterus, to see the fallopian tubes, to